Hello, welcome to my YouTube channel. In this video, we will explore the key factors of homebound status and medical necessity in home healthcare. Homebound status refers to a patient's inability to leave their home without considerable effort or assistance due to their medical condition. This means that leaving the home is difficult and requires considerable effort or assistance. It is a fundamental requirement for Medicare coverage of home health services. It also emphasizes the goal of home health care, which is to provide healthcare services in the patient's home, promoting comfort and minimizing disruption to their daily life. This is particularly important for individuals with significant medical conditions or limitations. To be eligible for Medicare-certified home health services, patients must meet certain criteria, one of which is being homebound. This requirement is defined in the Medicare Benefit Policy Manual and is a condition for Medicare reimbursement. The home health agency should determine, prior to admitting the patient, that the supporting documentation for which the physician attested to meets the required homebound criteria below. Criteria 1. Criteria 1 must have at least one of the following. 1. The patient must either, because of illness or injury, have a need for aid or supportive devices such as crutches, canes, wheelchairs, and walkers, the use of special transportation, or the assistance of another person in order to leave his or her place of residence, or 2, have a condition such that leaving his or her home is medically contraindicated. Criteria 2. Criteria 2 must have both of the following. There must exist a normal inability to leave home, and leaving home must require a considerable and taxing effort. Examples of homebound status scenarios. 1. A patient recovering from major surgery who is unable to leave their home without substantial pain and assistance. 2. An individual with a severe disability who requires the use of a wheelchair or other mobility aids to move, making it difficult to leave the home. 3. A patient with a chronic illness such as congestive heart failure who experiences significant symptoms such as shortness of breath and fatigue that limit their ability to leave the home without great effort. 4. An older adult with multiple chronic conditions who is at high risk of falls and requires assistance for mobility, making it impractical to leave the home. 5. A patient with upper extremity fractures that limit their ability to open doors. 6. A patient with fractures of lower extremities hindering walking. 7. Inability to communicate effectively due to medical conditions such as a tracheostomy. 8. Patient requiring continuous use of oxygen due to shortness of breath. 9. Stroke patient with residual effects such as paralysis. 10. Inability to bear weight. 11. Inability to leave home unattended and/or requiring maximum assistance to leave the home. Medical and functional limitations that can help support homebound status and medical necessity: paralysis, patient chair or bedbound, shortness of breath with minimal exertion, draining wounds, post-surgical drains, ostomies, indwelling catheter, blindness and/or deafness, severe mental disability, severe pain with ambulation, contagious disease, psychiatric or neurological conditions such as Alzheimer's, dementia, resulting in refusal or uncooperation to leave home. Patient is not homebound when there are frequent absences from home for social reasons. Patient is able to go to work or do volunteer work or physically attend college or school. This excludes absences from home for medical reasons. Please note that patients are allowed infrequent and brief absences from home for non-medical reasons such as a trip to the barber or the beauty shop, a trip to the grocery store or pharmacy, attending church, a wedding, or a family reunion. Sample homebound status documentation. Patient has a recent complex pulmonary medical history of chronic respiratory failure and acute on chronic bronchitis, which causes her to be easily fatigued, have poor activity tolerance, decreased pulmonary endurance with poor functional capacity, and finds it difficult and exhausting to leave the house or perform tasks. She is oxygen dependent and has shortness of breath at rest. Patient is unable to perform tasks due to frequent exacerbation of shortness of breath with dropping O2 sets upon minimal exertion. She has neuropathic pain due to diabetes and pain to bilateral knees due to osteoarthritis, exhibited by guarding behavior and reluctance to move, interfering with functional status, thereby impacting activities of daily living. Patient with a complex cardiac history of congestive heart failure with a decline in strength which causes poor activity tolerance and decreased cardiac endurance with poor functional capacity that limits her capacity to participate in activities of daily living or tasks. Next, we will look at the topic medical necessity. Medical necessity means that covered services must be reasonable and medically necessary for the treatment of an illness or injury based on the patient's condition, complexity of requested service or services, and accepted standards of clinical practice. Supporting documentation for medical necessity examples are recent hospitalization, recent new or exacerbated diagnosis, recent marked decline in functional status, recent falls, fractures, stroke, or brain injury, new or recently changed medications, change in caregiver with knowledge deficiency noted, presence of a wound, urinary catheter, drains, IV line, or ostomies, diabetic care with no available, willing, or capable caregiver to perform care. Sample medical necessity documentation. Example of a medical necessity documentation: patient with discontinued blood pressure medications due to recent hypotension resulting in a fall causing traumatic brain injury and hospitalization. Skilled nursing required for observation and assessment to evaluate efficacy, complications of prescribed changes to plan of care and treatment regimen, and report findings to physician. Instruction in disease process management of hypertension, medication management, and safety precautions at home. Patient requires skilled intervention of physical therapy for exercises to increase strength and endurance, implementation of safety measures, and evaluation for assistive devices due to impaired function and declining functional ability as demonstrated by recent fall, and limited independence in activities of daily living. Thanks for watching. For more videos like this, be sure to subscribe. If this video was helpful, hit the like button. It helps others find it too. For helpful downloadable digital resources on home health management, check out the links below. For questions and insights, drop a comment. And if you know someone who could benefit from this video, feel free to share. See you in the next one.